The breast is a glandular organ that has milk-making lobes that interact with your bloodstream. Milk is made in these lobes and funneled down through collapsible milk ducts to pores at the end of your nipple. You could have anywhere from 4 to 18 nipple pores where your milk can come out to your baby or a pump. Milk that does not come out of your nipple can be absorbed in your body through your lymph system. Nipples come in many shapes and sizes. The size, shape, and length do not determine how well your baby feeds. We call it breastfeeding and not nipple feeding. But do be aware of what your nipple looks like during pregnancy. Interventions during labor and delivery, such as having a lot of IV fluids, may make your nipples look flat or inverted. It may look like this for a few days or even weeks after delivery. This may make latching more challenging at the beginning. The size of your breast also does not indicate your milk production. Very small breasts can make just as much milk as very large breasts. Everybody's body has a different capacity to make different volumes of milk. We call this breast storage capacity. It is not determined by the size of your breast, but by how much milk-making tissue is inside of it. Those with a large storage capacity can hold more milk at any given time, and baby may take large volumes less often. Those parents can go longer between feeding or pump sessions without feeling uncomfortable. With a smaller storage capacity, you can hold and make less milk in the breast at any given time. Babies have less milk available, so they feed smaller volumes more often. These parents may experience discomfort if they go too long between feeding, or see a drop in supply if they don't feed or pump enough. Typically, as long as the breasts are emptied frequently, both types of storage capacity will make plenty of milk to feed your baby. The more milk you move from the breast, the more milk your body will make. Your body wants to feed however many babies were born. A body that consistently moves milk will continue to make more milk. A full milk supply is the ability to make 24 to 30 ounces of milk in a 24-hour period of time. Your body does want to figure out how many babies were born and how much milk that baby is taking. Milk that sits too long in the breast can cause inflammation in the breast, which we would call a plug duct or mastitis. That's inflammation. Expect your milk volumes to change throughout the day. Most people find they have the highest volume of milk first thing in the morning and smaller volumes of milk later in the evening. This helps to hydrate your baby in the morning and eventually help them not poop overnight. The longer you go between feedings, typically the higher water content or volume in your milk. The shorter you go between feedings, the higher the fat content and smaller the volume. All milk is good milk, and your body is trying to give your baby exactly what it needs. What you eat can change the flavor of your milk, but not the nutrient content. Nutrient content is based on the age of your baby and how far away from pregnancy you are. how often you're moving your milk as well. Milk can range in color from blue to white to yellow, orange, and even green. This is usually from what you are eating or drinking. Pink milk usually means you have a little blood in your milk and you want to explore why so you can fix it. Each breast can work independently as well as together. It is possible to successfully breastfeed on only one side. People tend to make more milk on the right side or the right breast, but you can also make more on the left. Each breast also has its own flow rate, volume of milk it produces, and flavor of milk even in the same feeding. How do you know your body will make enough milk for your baby? Good indications are a change in breast size and areola color during pregnancy, as well as little bumps around the areola that are called Montgomery glands. Less than 10% of pregnant people who give birth will not make enough milk for their babies. There is always a reason why. Common reasons can include breast tissue that never developed during puberty, a thyroid or hormone disorder that is uncontrolled, undiagnosed, or unmedicated, or a history of some kind of difficulty getting or staying pregnant. There may be a history of some kind of breast trauma or surgery, or the breast was not stimulated well enough in the early days after birth. Let's talk about milk. Colostrum is milk. It is your first milk that has been produced in the breast since 10 to 14 weeks gestation and ready for whenever your baby is born. Some may naturally see it leak around 34 to 38 weeks. It is also normal not to see it at all. It is a thick, sticky, syrupy first milk that is the perfect nutrient balance for a newborn. It is a high protein laxative milk that helps baby take their first poops. Birth of the placenta triggers oxytocin and prolactin to increase and release colostrum to be removed by your baby. As long as you have a placenta intact, you will have colostrum. Once the placenta is fully birthed from your body, your milk will take several days to transition this colostrum to mature milk. One important skill is hand expression. Because colostrum is thick and sticky, it can take a little time and use of the hands to move this milk, which can be more effective than a breast pump. To hand express, start by giving your breast a gentle shake and a massage. Gently massage the breast for a few minutes. That's because this thick milk needs encouraged to move down your milk ducts. Then take your hand in either a C or a U shape. Place your finger and thumb where the areola meets the breast and apply gentle pressure through your areola behind the nipple. You want to make sure your finger and thumb meet behind your nipple symmetrically to encourage milk to come out of your nipple. Don't get too close to the nipple. You won't see your milk move that way. You want to make sure to do symmetrical movements behind that nipple. It may take several minutes of gentle massage and compression before you see your colostrum. Your colostrum may appear clear and shiny or thick and creamy. Don't be alarmed if you don't see any your first try or if you never see more than small amounts. It is generally considered safe to start harvesting your colostrum to store in a syringe in the freezer prior to your baby's delivery, starting around 36 to 37 weeks if you have a low risk pregnancy. Consider speaking with your birth practitioner regarding collection of colostrum prior to birth. Colostrum is in small amounts as your baby has a small stomach. All of our stomachs are the size of our fist, but they expand to hold what we eat. Babies are born constipated and fluid overloaded with a fasted stomach. It takes about 3 days for the stomach to stretch and hold larger volumes. It takes about 3 days for babies to poop out their meconium, their first poop, which is thick, tarry, and black. It also takes about 3 days for colostrum to transition to mature milk. Because of this, it is normal for babies to lose 7 to 8% of their birth weight in the first 3 days during this process. They will start to regain their birth weight as milk transitions from colostrum to mature milk and increases in volume.